Hello guys, welcome back to my YouTube channel. It's your girl Nurse Juke. Today we'll be talking about what you need to know about bleeding during pregnancy. Is bleeding during pregnancy normal? Well, that is what we will be looking at in this slide. Firstly, vaginal bleeding during pregnancy has many causes. Some are serious and others are not. And bleeding can occur early or later in pregnancy. Bleeding in early pregnancy is common. In many cases, it does not signal a major problem. Bleeding later in pregnancy can be more serious. However, vaginal bleeding at any time of pregnancy ought to imply trouble or any underlying condition. And then let's look at difference between spotting and bleeding. There are difference between bleeding and spotting. Spotting is a drop of blood, a slight drop of blood that resolves on its own. And bleeding is a glide of blood that is extra than a blood, and it does not, most times it does not resolve on its own. So when this occurs, or when you notice a bleeding that does not resolve on its own, you need to see an obstetrician. And then we have the causes of bleeding. What are those things that are likely to cause bleeding? Number one, we say we have sex. There might be a mild bleeding after sex because of the cervical smoothness, and in this case, there are no cause for alarm. And then we have infection. Bacteria like chlamydia, gonorrhea, and different sexually transmitted infection or urinary tract infection can cause mild bleeding. So there's every need to visit the clinic for proper checkup. And in this case, it is advisable you treat every infection to avoid complication. And in this case, you are advised to visit the hospital. And then implantation bleeding is occurs during fertilization. So when the embryo is embedding on the uterine wall, it can cause a slight bleeding. So in this case, there are no cause for alarm because implantation is taking place, and it usually occurs at the first trimester. So during this implantation, there is usually a slight bleeding, which is known as spotting, and there are no cause for alarm. And then we have molar pregnancy. This is an uncommon situation where there's abnormal tissue growth. In this case, there is no embryo growing, there is no baby growing. The only thing growing there is the tissue. So, and it can lead to bleeding. So in this case, when you notice a bleeding, visit the hospital for proper examination. Let's know if it is actually a baby that is growing or a tissue that is growing. And in this case, you will present with signs and symptoms of pregnancy. So it is usually hard to differentiate from this molar pregnancy and normal pregnancy. So there's every need to go and visit the hospital for proper assessment. And then we have ectopic pregnancy. This is a life-threatening condition where there's an implantation of embryo outside the uterus, especially at the fallopian tube. So this can lead to bleeding when the pressure around that area is much. So it can lead to bleeding because the embryo did not implant where it's supposed to. So in this case, you need to visit the hospital for proper examination, or you need to visit the hospital for surgery, because if you leave the baby to keep on growing at the fallopian tube there, it can rupture the fallopian tube and it can lead to bleeding that cannot be stopped. And again, we also have subchorionic hematoma. This is bleeding from one of the membrane that surrounds the embryo inside the uterus. So this usually resolves on its own. And then we have cervical polyps, a non-cancerous cell on the cervix that bleed during pregnancy because of the estrogen level. So there's every cause to visit the hospital so that we will know what is causing the bleeding and how to manage it properly. And then we have miscarriage. This is the destruction of pregnancy within the 12 weeks of pregnancy. So in this case, when you notice a heavy bleeding or even a slight bleeding from second, third trimester, you need to visit the hospital for proper management. If you can do evacuation or whatsoever procedure that is suitable for you at that point in time. And we have pelvic examination or ultrasound. So most times or sometimes it can cause bleeding due to the procedure. Maybe during pelvic examination, there might be a rupture or there might be an abrasion or something that can cause those slight bleeding in a pregnant woman. And then we have some investigation that we can carry out to rule out what is actually causing that bleeding or even spotting. We have physical assessment to decide the reason for the bleeding. We have ultrasound scan to visualize the image of the soft tissue. So in this case, we visualize to know if there is a baby there or if the baby is still viable or not. And then we have hematocrit level to check for anemia. In this case, we run this test to note anemia in a case where a woman has been bleeding for long. We run this test to know if the PCV is still normal or to check if there is anemia due to the bleeding. And then we have urinalysis to check for urinary tract infection. If we rule out any, we treat it immediately to avoid further complication. And then we have MRI, which is magnetic resonance image. We run the MRI to examine. So these are the tests we run to examine the tissues and the organs of the pelvic organs to rule out any abnormality that can likely cause that bleeding that a woman is experiencing. Now, what are those treatments that we can carry out? What are those treatments we can give to this kind of people? Like I said, we run those investigations to rule out. Now, before the major treatments, we have some things you can do to prevent this bleeding or to control this bleeding or to manage this bleeding. We have relaxing and staying off your feet. You need to rest to avoid further complication and avoiding sex. In a case where you have sex and there is a bleed, you experience bleeding, you need to avoid sex at that stage. And then avoid traveling, those activities that can stress the baby in utero, you avoid them. Then adequate bed rest. As a pregnant woman who is having those bleeding problem, you are advised to have adequate bed rest. You are also advised to avoid those activities that can increase the chances of bleeding. And then we have the final stage, hospitalization. This hospitalization is in those severe cases like molar pregnancy, ectopic pregnancy, miscarriage, and what have you. So we hospitalize you and we carry out a surgical operation. So in a cases where bleeding are severe and a lot of intervention things, a lot of drugs have been given and other things have been done and it's not stopping, we carry out a surgical operation, because if we allow you to keep on bleeding, it can lead to anemia. And what does anemia do? When there is shortage of blood, can lead to anemia. From anemia, the blood is not carrying enough oxygen. Before you know it, the brain will cease to function, the heart will cease to function, and the patient will die. So these are what we do to save the woman's life. So if it can result to evacuating the baby, we can do that to save the woman's life. So we've come to the end of today's slide. So if there are any question you want to ask, you can drop it at the comment section, and make sure you subscribe to my channel to get more updates, to get more videos. Share and like and comment. So subscribe. Thank you so much for watching. See ya. Bye.